We're here, OrthoVirginia, Wednesday morning. Join now, Dr. Neil McGroarty. Doctor, thank you so much for taking some time out of your morning to chat with us. We've got a lot to dive into. It's been a while since we've had an OrthoVirginia doctor due to the holidays, so you're the guy marking the triumphant return.
Absolutely. Thanks for having me. I appreciate
Yeah, of
being.
course. I want to start here. You work with foot, ankle injuries, things of that sort, and it's the question that I always have when you look at an injury report in sports. And of course, you're not working directly with the athletes, just providing your expertise, and it's an expertise I'm going to need because what's the difference between a high ankle sprain and a low ankle sprain?
Yeah, so the difference between a high ankle sprain and a low ankle sprain really deals with the what ligaments are ruptured or sprained. High ankle sprain normally it refers to injury to the syndesmosis, whether you're dealing with the ligaments higher up your ankle. Low ankle sprain is mainly the ATFL or the CFL, or maybe the peroneal tendons are involved. Normally, with the low ankle sprains, you can tape them up, get people back quicker. The higher ankle sprains usually has a little bit more moderate, with severity, it can be a little more severe. In terms of returning to play, it can take a little longer. And usually those are the ligaments torn of your syndesmosis, which helps stabilize your ankle and helps allow for a congruent ankle. It just takes a little longer to get those athletes back.
Gotcha. So, something that's also so interesting to me in the case of NFL and professional athletes, but NFL on the mind right now because of the playoffs. You see Caleb Williams, he kind of rolls his ankle in that game, and it's awe-inspiring that he's able to come back. I rolled my ankle once. I was in a brace for 3 weeks or whatever it is, and I could hardly put any weight on it. You see the same thing with Patrick Mahomes and all of these high-level athletes. And again, you're just providing your expertise, but is there ways or are there ways that these professional athletes kind of work their ankle ligaments to avoid injury when it does get rolled up on?
Yeah, absolutely. So the first thing is after they have such injuries, keeping the inflammation down is huge. Once your ankle gets swollen and the capsule gets distended, that's your ankle joint. It causes significant pain and lack of motion to the joint and really limits you. So for these athletes, they're immediately given, elevation, compression wraps, things that can keep down the swelling. And then additionally, they work on making sure their Achilles tendon doesn't get tight during that process. And then the other things they do is their trainers and their team docs have a slew of things to keep the inflammation down, the pain down. And then in terms of overall training and how to, keep them on the field, it's a lot of it's, continue to strengthen the peroneal tendons, continue to strengthen the other, aspects of the ankle and work on proprioception. That's huge after an ankle sprain. Getting people, mobile after an ankle sprain is big to get them back on the field. And then obviously having a graduated return to playing activities. And then they're monitored at all times, and they, wear their special tapes and everything like that to kind of keep their ankle solid so they can return back to play.
Gotcha. What are some of the more common foot and ankle sports injuries that you guys see?
Yeah, the most common foot and ankle injury would be an Achilles tendon rupture. So oftentimes people will be playing tennis or basketball. They feel like their teammate either threw the ball to the back of their leg or kicked them or something like that. That's a common thing. You hear that tennis player, someone will be up at the net and feel like one of their partners hit them with the ball. And really what that is their tendon ruptured. So that's a bad injury, and it's a big recovery. It needs to be repaired surgically. So that's the most common one I see for the middle-aged athlete. Those are your tendon quality kind of gets weaker with time, and so they're more at risk of getting a Achilles tendon injury. For the other athletes, for the people that are younger in college and maybe professional or high school, see a lot of ankle sprains. The other ones we see that are maybe potentially surgical would be a Liz Frank injury. That's an injury to your midfoot. Those often require surgery. You can see those in higher level athletes, as well as you get turf toe with the new cleats now and the artificial turfs. The rates of turf toe are significantly higher than they may have used to be when we were just playing on grass fields. So we see a lot of sprains of the what's called the turf toe refers to an injury to the metatarsal plate of the plantar plate of your first metatarsal phalangeal joint. So that's your big toe. So pretty much an injury to the big toe. Different levels of sprains there is kind of generally lumped into the term turf toe.
Yeah, I mean, turf toe, I think needs to go under a complete rebrand because I feel like it is much more painful and more difficult to come back from than an injury called turf toe.
It is. It is. Yeah. Yeah. And one of the guy who actually coined the term was one of my mentors and helped train me. So I've heard a lot about it. Yeah. Learned a lot about it. Yeah. So.
Really? So I'm gonna need you to give him a call up after we wrap up here because turf toe was it was way too nice. It's almost cartoonish. I remember the first time I ever heard my favorite player. I think it was Sean Alexander for the Seattle Seahawks back in the day. I think he missed like 6 weeks with a turf toe. And I remember the whole time, this is like 10-year-old, whatever, however old I was when it happened. I was like, it's turf toe. Just play on a hurt toe. They're like, why can't we just play on a hurt toe?
It's a bad injury, does not need surgery. It does need surgery sometimes, but not all the time, but it does put you out of commission for a while.
Did you? I think I heard through the grapevine you were a collegiate lacrosse player. Did you ever play through any turf toe like injuries?
No. I played lacrosse in college, but never had any turf toe injuries or foot and ankle injuries during my time there. But
that's
never
nice.
got banged up, as well as a bunch of my friends. But I think one kid I knew had turf toe, and everyone just made fun of him.
Yeah.
So because no, at the time we didn't know the severity of the injury. So
Exactly. You hear turf toe, you think he's not being tough playing through it, but that's besides the point. I'd love to know. We kind of touched on it before when I was talking about the differences between a high and low ankle sprain and what that kind of was. But I think you mentioned the severity is a little different between the two. Why does it tend to be where a high ankle sprain are more severe than low ankle sprains?
yeah, so if you have a low ankle sprain, you still have a congruent ankle, and your ankle is still pretty stable, other than the fact that you've torn your ATFL or your CFL ligaments. But when you get higher up, they're referring to ligaments of your syndesmosis, and when you injure those are responsible for keeping your ankle congruent and keeping the alignment of your ankle congruent. And when those get ruptured, you or get injured, you put a lot more increased stress on your ankle joint, and also it's just a more painful area. You probably have more nerve endings to that area, so you feel it more as well. And it kind of radiates up your leg more, and so it's just it's a worse injury.
Yeah, that just does not sound as fun. Something I've loved talking with the different OrthoVirginia doctors we've had throughout our time chatting every Wednesday is the rise of pickleball. And pickleball is such, and I don't want to, this word makes, it's a more explosive sport, I think, than the people who are playing it were used to prior to playing it. And I wonder if you've seen a rise in Achilles injuries and things like that since the rise in pickleball has happened over the last handful of years.
Absolutely, yes, 100%, 100%, yes. And I think the other point of it is you're not playing a singles pickleball; you're playing with a teammate. So people are maybe overextending themselves to try to, win one for the team, and maybe they should just let that one go. So, but definitely, absolutely, it has to do with their age, has to do with their conditioning, has to do with their strength of their Achilles tendon, as well as if they have a tight gastroc, they're more at risk of getting Achilles tendon rupture, as well as they have chronic tendinopathy to their tendon. That puts them more at risk of getting a rupture, and that all comes with age. So that's the other thing. So.
And how do you help patients with arthritis in feet and ankles as well?
Yeah. So, with arthritis, depends how bad it is. Sometimes if they have arthritis in a bad deformity, if those need surgery, that's usually a fusion. If they have bad ankle arthritis, you can replace the ankle, and the outcomes now of the new ankle replacements are doing well. But ankle arthritis is not nearly as common as hip or knee arthritis. Most of the people that get ankle arthritis are people that either had post-traumatic from a fracture or from chronic ankle sprains over the course of their lifetime, puts the ankle at a increased stress at different areas, and they get a deformity over time, and that causes arthritis. But again, we try to just get people mobilized and get them back moving after that surgery, after they've recovered from the initial surgery. So.
And where can listeners go to schedule an appointment with you guys at OrthoVirginia if they've played pickleball maybe a little too aggressively or they're dealing with arthritis?
Yeah, so they can go to orthovirginia.com and they can look me up, and I'd be happy to see them. I will say to all listeners out there, I've seen a lot of recent Achilles tendon injuries that patients didn't even know they had, and they just like, oh, my leg hurts, and they had an Achilles tendon rupture. And I'm like, has anyone ever seen you before? They're like, oh, it just hurt. I had one general, yeah, I mean, they come in all the time and they're like, oh, I just thought I had an Achilles tendonitis. And I'm like, oh, you ruptured your Achilles tendon. So the sooner we fix it, the better the outcomes. And so those are things that people need to be aware of. If their Achilles tendon hurts or they feel a pop in their leg, they should probably come and see me. Or if they have chronic, pain in their foot or ankle, it could be due to arthritis. I'm happy to help them out. So.
And here's one last question before we let you go here, because in the rise of sports, professional sports now, you hear the ACL stuff, and I know that's the knee that's slightly different than the foot and ankle, but you also hear about these Achilles injuries like Tyrese Halliburton in the NBA going down with a torn Achilles. When it comes to those two injuries in today's modern medicine world, which do you think, and this is a weird way to phrase, but which do you think is more difficult to come back from in the long term?
Oftentimes ACL injuries have other associated injuries with it. They can have osteochondral defects that can happen to the knee, or they can have meniscal injuries, or they can have other ligamentous injuries to the knee. So there is a spectrum with the ACL injuries, but Achilles tendon injuries take a full year for these athletes to get back. And these are high level, healthy athletes that are getting the, ample amounts of therapy and treatments post-operatively, and it still takes them a full year to be effective. And even then, they might say it's not 100% on that side. So I don't know. I think long term, I think some of these Achilles might do worse than some of the ACLs. But again, the ACL is a spectrum of other injuries that can happen with it. So it just depends. But Achilles is not a benign injury. It's an easy surgery to do, and it's a quick surgery. But the recovery is a long recovery to get to full strength. So.
Gotcha. That makes a lot of sense. Appreciate your time. Thank you for your insights as well. Enjoyed talking with you. Have a great rest of your day.
Take care. Thank you so much.